Imagine that within your body, invisible beings are hiding, causing silent havoc and even confusing the most experienced doctors. Welcome to an intriguing dive into the world of parasitic worms. In this video, we will explore 10 alarming signs that these unwanted intruders may be living inside you, undermining your health in ways you never imagined. Get ready for a scientific, yet accessible journey that will reveal a mysterious side of the world of parasites. In the end, we will provide valuable information that can help you protect your health. If you want to continue exploring fascinating content like this, don't forget to subscribe to our channel. Now, let's delve into this intriguing world of parasites. Sign 1. Persistent gastrointestinal disturbances. The first sign that parasitic worms may be inside you is persistent gastrointestinal disturbances, such as diarrhea, constipation, nausea, and abdominal pain. Often, these symptoms are confused with other digestive conditions, making diagnosis challenging. We will explore how these parasites affect your digestive system and why doctors may have difficulty identifying them. Worms can lodge in the intestines, causing inflammation and interfering with nutrient absorption, leading to gastrointestinal symptoms. Diagnostic confusion arises because these symptoms are common to many other digestive conditions, such as irritable bowel syndrome and bacterial infections. Additionally, laboratory tests do not always detect the presence of worms, making diagnosis even more challenging. Sign 2. Unexplained weight loss. Unexplained weight loss is the second telling sign of a possible worm infestation. You can be on a normal diet and still lose weight. We will discover how worms can cause this weight loss by competing for nutrients in your intestines, and at the same time, learn why this symptom can be so misleading to doctors. Worm infestations can lead to weight loss in various ways. Some worms consume the nutrients you ingest, depriving your body of what it needs to stay healthy. Other worms cause chronic inflammation, which can also affect appetite and the body's ability to absorb nutrients. For doctors, unexplained weight loss is a concerning symptom as it can indicate various serious conditions, from cancer to metabolic disorders. Sign 3. Chronic fatigue. Chronic fatigue is a common but often overlooked symptom of worm infestations. We will find out how these parasites drain your energy, leading to a constant feeling of tiredness and weakness. We will understand why this symptom can be difficult to associate with parasitic worms and how it affects the quality of life. Chronic fatigue is a debilitating symptom that affects a person's ability to carry out daily activities. In the case of worm infestations, fatigue occurs due to various factors, such as the loss of nutrients to the parasites and the immune system's response to the infestation. Diagnostic confusion arises because fatigue is a common symptom in many medical conditions, from sleep disorders to autoimmune diseases. Patients can be wrongly diagnosed with chronic fatigue syndrome or depression when the underlying cause is, in fact, a parasitic infestation. Sign 4. Unexplained allergies. Did you know that worm infestations can trigger allergic reactions? We will explore how certain types of worms can cause skin rashes, itching, and sneezing, leading to a misdiagnosis of common allergies. We will understand how parasites induce these allergic responses and why they can confuse doctors. The relationship between parasitic worms and allergies is intriguing. Certain types of worms, such as mites, can cause allergic reactions on the skin, resulting in rashes, itching, and swelling. Additionally, The presence of worms in the intestines can trigger a systemic allergic response, leading to sneezing, a runny nose, and other common allergy symptoms. Diagnostic confusion occurs because these symptoms are similar to seasonal or food allergies. Doctors may prescribe antihistamines while the real cause, the worms, remains unidentified. Sign 5. Unexplained anemia. Unexplained anemia is the fifth sign that parasitic worms may be present. We will understand how blood loss caused by these intruders or competition for nutrients in the intestines can result in low hemoglobin levels. This often goes undetected, making diagnosis even more challenging. Anemia is a condition in which the body does not have enough healthy red blood cells to carry oxygen to the tissues. Worm infestations can cause anemia in several ways, including blood loss from worms attaching to the intestinal wall or competition for iron and other essential nutrients. Diagnostic confusion occurs because anemia is a common symptom of many medical conditions, from nutritional deficiencies to chronic diseases. Doctors often perform blood tests to diagnose anemia, but the specific type of anemia caused by worms is not always detected by these tests. As a result, the underlying cause may remain unidentified, leading to ineffective treatments. Sign 6. Muscular and joint pain. The presence of parasitic worms in the body can cause chronic muscular and joint pain, the sixth symptom. We will explore how these parasites trigger inflammation and discomfort in these tissues, leading to misdiagnoses such as rheumatic diseases. We will understand why this confusion occurs and how to identify the true cause of the pain. Some parasitic worms, such as filariasis and toxocariasis, can migrate to the muscles and joints, triggering an inflammatory response. This results in chronic muscular and joint pain, similar to the symptoms of arthritis and other rheumatic diseases. Diagnostic confusion arises due to the similarity of these symptoms to other musculoskeletal disorders. Doctors may incorrectly diagnose patients with rheumatoid arthritis, fibromyalgia, or even muscle injuries when the underlying cause is a parasitic infestation. Sign 7. Skin problems. Signs on the skin, such as rashes, lesions, and persistent itching, are the seventh sign of a possible infestation by parasitic worms. We will examine how these parasites can cause notable skin problems and why these manifestations can be confused with other dermatological conditions. Some worms, such as scabies mites and botfly larvae, can cause remarkable skin problems. Infestation by these parasites results in rashes, sores, or skin lesions that often itch intensely. Doctors can confuse these symptoms with common dermatological conditions, such as dermatitis or bacterial skin infections, leading to misdiagnosis and ineffective treatments. Persistent itching often leads patients to seek dermatological help repeatedly without a definitive resolution. Sign 8. Respiratory problems. Some worms, such as lung nematodes, can affect the lungs, resulting in respiratory symptoms such as coughing, shortness of breath, and even pneumonia. We will discover how these infestations can be misdiagnosed as common respiratory infections and how parasites affect the respiratory system. Parasitic worms that affect the lungs can cause a range of respiratory symptoms, including coughing, shortness of breath, wheezing, and even pneumonia. These symptoms are often confused with common respiratory infections, such as viral or bacterial bronchitis or pneumonia. The difficulty in differentiating respiratory symptoms caused by worms from other respiratory infections often leads to misdiagnosis. Additionally, lung imaging tests do not always show the presence of worms, making diagnosis even more challenging. Sign 9. Neurological symptoms. In severe cases, worm infestations can affect the central nervous system, causing symptoms such as seizures, confusion, and intense headaches, the 9th sign. We will understand how parasites can invade the central nervous system and why these symptoms may be misunderstood by healthcare professionals. Some parasitic worms have the ability to migrate to the central nervous system, causing a range of neurological symptoms. This can include seizures, confusion, intense headaches, and difficulty concentrating. Diagnostic confusion occurs because neurological symptoms are similar to those of other neurological conditions, such as epilepsy, migraines, and mood disorders. Correctly identifying the cause of these symptoms requires specialized brain imaging and specific laboratory analyses to detect the presence of parasitic worms in the central nervous system. Sign 10. Recurrent gastrointestinal symptoms. To conclude our journey, the 10th revealing sign of parasitic worms is recurrent gastrointestinal disturbances. When symptoms persist despite treatment, it may be a sign of an underlying infestation that escapes detection. We will see why this can be a diagnostic challenge and how to identify the problem. Gastrointestinal disturbances that persist over time, even after repeated treatments, can be a clear sign of an underlying parasitic infestation. This occurs because conventional treatments, such as antibiotics, may not be effective against some types of worms. The infestation can persist, causing chronic symptoms such as diarrhea, abdominal pain, and nausea. Diagnostic confusion occurs because doctors may believe that the symptoms are caused by other chronic conditions, such as irritable bowel syndrome. Specialized stool tests may be required to identify the parasitic infestation, as worms are not always detected in routine tests. As we continue to explore these revealing signs of worm infestation, you will gain a deeper understanding of how these parasites can deceive even the most experienced doctors. Remember that knowledge is the key to prevention and treatment. If you enjoyed this content and want to continue learning about fascinating topics, don't forget to subscribe to our channel. Stay informed and take good care of your health.